Novarel, chorionic gonadotropin for injection USP. This guide will show you the proper way to mix and administer a 5,000 IU vial of Novarel. If your doctor has prescribed a dosage less than or greater than 5,000 IU, make sure to follow your doctor's instructions. You've been prescribed Novarel as part of your treatment. It's important to take this drug exactly as directed. This video will help prepare your medication and show you how the intramuscular injection should be performed. Get ready. Wash your hands well with soap and water. Use alcohol pads to clean the surface. Alternatively, you may use alcohol on a gauze pad. And gather 1 vial of Novarel, 1 vial of bacteriostatic water, 1 sterile syringe, 1 intramuscular needle for mixing, and 1 intramuscular needle for injection, alcohol swabs, gauze, and a disposal container. Flip the caps off 1 vial of bacteriostatic water and the vial of Novarel. Wipe the tops with an alcohol swab. Now you're ready to fill the syringe with bacteriostatic water. Fill the syringe. Remove the syringe from the wrapper. If there is a capped needle on the syringe, tighten it by twisting clockwise. If there is no needle, twist a mixing needle onto the syringe and remove the cap. Pull back the plunger to the black line that corresponds to the volume of bacteriostatic water your healthcare provider has recommended, typically 1 milliliter. Please note, air is just being drawn into the syringe at this step. You are not withdrawing any bacteriostatic water at this point. While holding the barrel of the syringe, insert the needle through the rubber stopper of the water vial. Then push the plunger all the way down to transfer the air in the syringe. While still holding the plunger down, turn the syringe with vial attached on an angle. Making sure the needle tip stays in the water, pull back the plunger to transfer the prescribed amount into the syringe. Place the vial on a flat surface and carefully withdraw the needle. Discard the used vial of bacteriostatic water in the disposal container. Now you're ready to mix your vial of Novarel. Mix with Novarel chorionic gonadotropin for injection, USP. Place the Novarel vial on a flat surface, and while holding it firmly, take the syringe you've just prepared and insert the needle through the center of the rubber stopper. Holding at a slight angle, slowly press down on the syringe to inject the bacteriostatic water into the vial. Hold the plunger down and gently swirl until the solution is clear. Do not shake the vial. While holding the plunger down, turn the vial upside down and pull back on the plunger to withdraw the solution that corresponds to the volume of bacteriostatic water you injected into the vial, typically 1 milliliter. While withdrawing the liquid, slowly adjust the needle to minimize any air entering the needle. Remove the vial and discard. Now you're ready to prepare your injection. Prepare the injection. Carefully recap and twist off the mixing needle from the filled syringe and immediately discard it in the disposal container. Replace this with the unused intramuscular needle, twist it on, and remove the cap. To remove any air bubbles, hold the syringe pointing upward, pull back slightly on the plunger, and gently tap on the syringe until any bubbles rise to the top. Slowly push the plunger until 1 small drop forms on the tip of the needle. Tap the syringe to remove the drop, and then carefully recap the needle to maintain sterile conditions as you prepare to receive your injection. Now you're ready to receive your injection. Inject your medication. Another person is needed to give the intramuscular injection of Novarel. The medication should be injected into the muscle of the upper outer region of the right or left buttock below the hip bone. Clean the site with an alcohol swab and let it air dry. To relax the muscle, stand with your toes slightly turned in, or bend your leg slightly, placing your weight on your other foot. Uncap the needle and insert it straight into the skin in one smooth motion until the needle disappears. Slightly pull back on the plunger. If there is no blood in the syringe, proceed with the injection. If there is blood, withdraw the needle and replace it with a new one. Then repeat the injection process. Pull the syringe straight out again using one smooth motion. Apply pressure to the injection site with a sterile gauze pad. Discard the needle and syringe, any open vials, and all used injection materials in the disposal container. The container should be disposed of at an appropriate collection center or according to your doctor's instructions. Novarel, chorionic gonadotropin for injection USP, is a prescription medicine that contains a hormone to help stimulate healthy ovaries to make eggs. Novarel is used for women who need medical help to get pregnant. Your doctor may prescribe more than one medicine as part of a pregnancy plan. Important safety information. Do not use Novarel if you have begun puberty at an unusually early age, have prostate cancer, or have had a prior allergic reaction to this hormone. This hormone may cause harm to an unborn baby when given to a pregnant woman. Novarel may cause serious side effects. It sometimes stimulates the ovaries too much. This is called ovarian hyperstimulation syndrome, OHSS, and can be a serious medical problem. OHSS may cause pelvic pain or breathing problems, or it may make you urinate less. In rare cases, patients with this problem have had serious lung problems. Novarel can also cause blood clots and strokes. Call your doctor or get medical help right away if you have severe pelvic pain, nausea, vomiting, diarrhea, sudden weight gain, trouble breathing, or decreased or no urination. Novarel may cause you to be pregnant with twins or more than 2 babies at the same time. Other side effects of Novarel include headache, irritability, restlessness, depression, fatigue, swelling, and pain at the site of injection. Anaphylaxis has been reported with urinary-derived HCG products. These are not all the side effects with Novarel. Ask your doctor or pharmacist for more information. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. You may report side effects to FDA at 1-800-FDA-1088. Please see important safety information and the full U.S. prescribing information by clicking on the link on this webpage. For additional information on Novarel or other Ferring products, visit www.ferringfertility.com.